Hey, it's Meredith. I'm 28 weeks along and came over to the MUSC Labor and Delivery Unit to get a brief tour. I heard on their website that they are having all new renovations, so I wanted to come check it out now that I'm in my third trimester. And I'm here today with Karen Stephenson. She is the manager of MUSC Labor and Delivery, and we're kind of reviewing the bed at this point, so we thought this would be a good portion to show you guys of the tour. And Karen's going to show us how the birthing bar works on the bed.
Okay, generally when somebody starts pushing, we're looking for gravity to assist also. So we use two things. We can use just support from family or the nurse at the bedside to actually get them up into that kind of squatting position. But if they feel like they need a little bit more security, we put the squatting bar, and what they'll do is they'll sit here. There's like a little notch in the bed, and they'll sit on the bed, and they'll actually hold on to this bar. I don't really want to demonstrate, but they'll be able to, during the push, they can bend down like that, and then during the time that they're relieved or in a resting phase, they're able to relax back. So they do have to kind of get up on the bar and crouch each time if they want to relax during it. But most people are pretty comfortable, and we'll just hang out and talk during it and then wait for the next contraction. And because once you start pushing, it's almost kind of like a light at the end of the tunnel, where you can see that being an active participant, you'll have a quicker delivery, or you see gain, by visualizing the baby's head. Something that, well, anytime that early in labor, if you just need to relieve some pressure or stress, what the birthing ball does is it gives the woman the ability to kind of sit in one spot and move her hips around a little bit. It's not a bouncing ball. It's just something that is comfortable. You've got the body mechanics that the baby's kind of able to come on down and gravitate instead of laying in the bed. Laying in the bed is probably the place that you don't want to be. The more you move around, the more that baby can kind of navigate the pelvis to come on out. So the birthing ball is something that's just more for comfort. It's a kind of a pressure release. Come on in, Meredith. This is our labor room 4. I just want to show you the equipment that we have in here. And it's nice to take a tour because once you're able to see it, you kind of desensitize a little bit and you get a little bit more comfortable, so that when you're first in here in labor, that it's not overwhelming and everything just doesn't seem like the strange equipment. And everything in this room has function. We, of course, have the labor bed, and you can see we have the squat bar. I was demonstrating that earlier. But the labor beds each have the capacity to break down the foot of the bed for the delivery, and it's got these little foot pedals that keep your legs relaxed and in a good position for the delivery itself. It also has these little handles that we use while you're pushing. You're able to pull back on them to kind of give support and kind of bear down a little bit like that. It's all electronic, so you've got electrical panels on the side here to elevate the head of the bed, to have your lights, and have your, it actually has a capacity to have pressure releases on the mattress. You can see here there's like lumbar support, and it's a softer and firmer seat for you, so that for your comfort, that if you're sitting in a bed for hours is never comfortable, especially while you're getting ready to have a baby. It's actually on all wheels, so that if we have to go to the OR, that you can just stay on this bed. If you have to go there for your delivery, and you'll see we have an IV pole, that's where your fluids will be. This is the electronic fetal monitoring monitor, and it's a model so that we are able to see every pregnant person who's on the monitor in the facility, so that if I just F8, I can tell you who's laboring, and if I'm not at the bedside, I can still watch your baby. Okay. So that should be alleviate some of your apprehension.
So I'll just
after
have
you walk out.
monitor, I guess, strapped.
You have 2 monitors on. One traces the baby's heart rate, and the other one traces your contraction pattern. And these are the straps are soft, but they'll stay on you the entire time. And so once the baby's delivered, we either put the baby up on your tummy and let you kind of dry the baby off, will help, and so you can kind of snuggle a little bit. And then once we'll get the weights and do the measurements and everything. Then we'll take the baby over from you and put the baby over into this overhead warmer here. This is a radiant warmer, and we're able to do an assessment on the baby, put the bands on, do the baby's footprints, give it its eye medication to keep it from getting an infection, and then we give vitamin K in the thigh so that it will start clotting mechanisms and prevent any bleeds or anything like that. So we have, and those are both, medications that are mandated through the law to give to newborn babies.
And I saw in your birth plan that's on the website, as you know, if you read the blog, I filled out it's muschealth.com/birth plan. And I saw that the eye medication and those things could wait until
we can
after
wait,
you bond.
absolutely. So if you want to have eye contact with your new baby, we won't put all that ointment in there to make it like all fuzzy.
Okay.
So yes, absolutely, we can wait.
Good. In the event that something wrong were to happen, I'm assuming you first noticed it on the monitor.
We
you
would.
gotta walk me through. I know the birth plan's kind of out of the window once something
Right.
you see, and I completely understand that and appreciate it
Right.
to know that it's in the right place.
Most birth plans, and yours is a very reasonable birth plan. It's stuff that we would do automatically, and we want the birth experience to be unique to every individual, and we understand that this is your experience, and this is something we're helping you with. If something should go wrong, we do detect it on the monitor. Generally, we have somebody in the room, and what we do at that point is everybody kind of comes in, tries to resuscitate the baby intrauterine. That means changing your position, trying to get, if the cord's in a vulnerable spot, that the baby's heart rate decreases. We'll try to roll you over to the other side, so hopefully that'll alleviate that. We watch the baby's heart rate, so we don't just jump the gun right away. We just kind of watch to see how this child is tolerating labor. But if it should go down, then we've got an operating room. We're fully staffed for that, 24 hours a day, 7 days a week, and we have an anesthesia group here also to cover that. And that's right across the hall. And that we have 2 ORs, and we have a little stabilization area so that when we do deliver the baby by cesarean, that there's a full NICU team there ready to take your baby and make sure the baby's safe and healthy.